And welcome to today's webinar, You, Me, and Community, Turning Action into Impact. Thank you all so much for joining us as we mark World Rabies Day 2025. My name is Dr. Michelle Tuma, and I'm the Northern Canada Veterinary Specialist here at Veterinarians Without Borders North America. For over a decade, I've worked closely with many northern communities to help prevent the spread of rabies, including through vaccination clinics, training, and community education. As many of you likely know, although rabies is a highly fatal disease, it's also 100% preventable through pet vaccinations. Due to the difficulty in access in veterinary care, particularly in remote communities, it remains a threat right here in northern Canada and Alaska, as well as globally. Every year, rabies claims nearly 60,000 human lives worldwide, with most deaths occurring in Africa and Asia, and primarily from dog-mediated rabies. The heartbreaking part is that nearly all of these deaths are preventable, through awareness, vaccination, and coordinated community action. This year's World Rabies Day theme highlights how individuals, professionals, and partnerships can work together to eliminate rabies and protect both people and animals. A quick word about VWB, or Veterinarians Without Borders North America. We work to improve animal health, human health, and the environment using a One Health approach that recognizes the connection between people, animals, and the ecosystems that we all share. Also, just a quick housekeeping note that today's webinar will be recorded and shared via YouTube afterwards. If you have any questions throughout any of the presentations today, please type your questions into the Q&A box located at the bottom of your screen, and I'll direct them to our speakers at the end of all the presentation. So this morning for me, or this afternoon for you, I'm thrilled to be joined by three outstanding panelists who will share their experiences and insights into rabies prevention today. This includes Dr. Greg Pietsch, Assistant Professor of Veterinary Medicine at the University of Alaska Fairbanks and VWB Program Partner, specializing in rabies and northern animal health. Dr. Pietsch has spent time in remote Alaskan communities working to increase access to veterinary care. Kristina Drogormaretska is the country manager for Ukraine War Animals Relief Fund, or UWARF, and 12 Guards team member in Ukraine, bringing frontline experience with community-led initiatives. Kristina volunteers her time to help rescue dogs, cats, and other domesticated animals from frontline regions of Ukraine that have been destroyed and abandoned. She helps to ensure these animals receive the veterinary care they need to heal and find loving new homes. And we'll also be joined by Dr. Katinka Dabalog, former Senior Animal Health and Production Officer with the UN Food and Agriculture Organization, with decades of global One Health experience. Katinka is a current board member with VWB and has a wealth of veterinary experience working with communities and One Health organizations in Africa and Asia. And she's also fluent in 7 languages. So big thanks so much to all of our speakers for joining us today for this important conversation. And again, thank you to all of the attendees as well. Here's how we'll spend the hour together. First, we'll hear the brief presentations from each panelist. Then we'll move into a live Q&A session where you'll have the chance to ask questions. And finally, I'll wrap up with some key takeaways and closing thoughts. Without further ado, let's get started. So as I previously mentioned, Dr. Pietsch is a current faculty member at the University of Alaska Fairbanks and a valued VWB program partner. His work focuses on rabies in Arctic regions and improving animal health services in northern communities. Welcome, Dr. Pietsch.
Thanks so much, Michelle. It's a warm welcome. Thanks to everybody that's joining us today or watching in the future. This is a great webinar. I'm going to go ahead and just share my screen. Okay. Did that come up where everyone can see it, Michelle?
Yes, all's
Okay.
good. Thanks.
Okay. So yeah, I wanted to talk today about rabies in Alaska. Um, and so I've got a picture of myself. Um, and this is up in Utqiagvik, or otherwise known as Barrow, Alaska. So right up at the very top of Alaska a few years ago. And this is a dog I rescued there while doing some work. So we were taking a shot there by the Arctic Ocean. He came home with me, and he's named Utki after Utqiagvik. But yeah, I wanted to talk today about rabies in Alaska, and what we're doing. Before I get into that, I want to talk about, just mention a few people who helped me with this presentation, just shared some materials. Um, so special thanks to Louisa Castrodale, the section of epidemiology, Kimberly Beckman, our state wildlife veterinarian, and Jamie Parker, who is in our public health lab in here in Fairbanks, where all the rabies testing happens. So here's Alaska. All of our panels are spread out around the world today, but here we are up in northwestern North America. And this map shows where rabies is. So we tend to see rabies in Alaska in the coastal regions, in the Arctic, West Coast, and Southwest out through the Aleutians. And the rabies that we have here is primarily in foxes, both Arctic foxes and red foxes. One of the things I wanted to point out with this slide is that most of the people in Alaska, about 80% of our population, doesn't live in rabies endemic areas. So here I am in Fairbanks. We've got about 100,000 people or so in the greater Fairbanks area. We've got Anchorage and Matsu and Juneau. Here's our capital. So rabies is exceedingly rare in these areas. It's not endemic, but it's highly endemic all through the coastline. And what's important about this is all the resources, the veterinarians, the human health care, all those sort of things are around these population centers. So all through this area, it's really difficult for people to get access for basic things, just as rabies vaccine in areas where it's needed most. We always think about rabies as Cujo, the aggressive dog, really obvious, you know something's wrong. I wanted to just share a couple of videos. It's subtle. So I got this from the state of Alaska. This was a fox with rabies, and you can see he's got a little bit of a head tremor there, but at first glance, you may not notice anything is wrong with him. But that dog is rabid, and if he were to bite someone, bite another dog, perhaps, that could be transmitted. And rabies can be transmitted before we even show any clinical symptoms. So this is one of the things that's scary. We can have rabies right there in our driveway and not know it's there. This was an interesting case in 2023. This was a moose in Teller, Alaska, and this is a video I gleaned from Facebook. And it's just a moose walking through Teller, and people realized things weren't right, and he was euthanized, and it turns out this moose had rabies. The first documented case of rabies in a moose in Alaska, I believe in all of North America. We can see he is salivating a little bit because this is a neurologic disease. It affects the brain, it affects the cranial nerves, so it's difficult swallowing, and so we'll see animals salivating sometimes. But again, not glaringly obvious at first glance that this is a rabid animal. And this is really important because rabies is almost 100% fatal. Just about anyone that is exposed to rabies will die of rabies if not treated before clinical signs develop. It affects all mammals. Michelle mentioned, most commonly human exposure is through dogs, but we can certainly see a scenario where a dog and that fox mix it up. The dog develops rabies, exposes a human, and the human develops rabies. So it is preventable with vaccines, but that's not something that generally happens in the human population that we're vaccinating. Veterinarians, lab workers, high-risk individuals, I'm rabies vaccinated, but it's not part of the routine human vaccination protocol unless there's a special risk. If a person is exposed to rabies, there's a post-exposure prophylaxis. And in Alaska, that costs about $4,000 per person for the treatment. And that's just for the medications. That doesn't include the costs associated with administering the vaccine, transportation to treatment sites. If you look back to that map, we had this huge area of the coast of Alaska. Very few human healthcare resources there. So in many of the villages, it's at least going to a hub village where there's a adequate healthcare facility, or perhaps going to Anchorage or Fairbanks for several rounds of treatment. We have time away from work. And importantly, very importantly, in rural Alaska is potential loss of subsistence harvest. If it's moose season, if it's caribou season, if it's fishing season, and you can't go collect food for your family for the upcoming seasons, that's a big problem. We don't have access to healthy food out in our communities, our rural communities. Limited access, very expensive, heavy subsistence reliance, and so time away is huge. The good news is prevention works. I mentioned that I'm rabies vaccinated, and people can get rabies vaccines. It's about $500 per person. So that's a lot cheaper than $4,000 of post-exposure treatment, but that's still a pretty significant expense. I think I crunched the math, and just the North Slope borough of Alaska, it's kind of the northern Arctic rural area, to vaccinate the population there would be $8 million. What's really amazing though is a rabies vaccine for a dog or a cat, a couple bucks a dose. The number I got was $1.50 a dose. So very inexpensive to vaccinate dogs. And this was a cutie who we saw in Akiak on the Kuskokwim River this summer. So vaccination is really important. It's life-saving, both for the dog, but for people. One of the things that's happening in Alaska is we have what's called the lay vaccinator program. And how that works is community members are identified and they're trained to administer rabies vaccines. Generally, that's the local regional health corporations that are identifying those people within the community. It's volunteer. They're trained to properly handle animals, properly handle and administer the vaccines, and do the associated rabies vaccine certificate to create those records. And the state of Alaska provides all the vaccines and the supplies. So it's really beneficial to our communities. A big difference if there's a dog bite from a rabies vaccinated animal compared to a unvaccinated animal. In some cases, that animal might need to be euthanized and have its brain tested for rabies, which we want to avoid. So this is really beneficial to our communities. It's been going on since about the late 70s. Beyond the lay vaccinator program, there's a lot of community partnerships, and this is where University of Alaska Fairbanks comes in. I teach at the vet school here, and we've been working to partner with a variety of organizations. Here I am. This is in St. Mary's in January, working with, that's Genevieve from Veterinarians Without Borders. We're spaying a dog. We're doing rabies vaccines in that trip, basic wellness care, parasite prevention. These are a couple of communities that are here in the state doing a lot of work. Alaska Rural Veterinary Outreach, Alaska Native Rural Veterinary Incorporated, and we partner together with these things. We partner with regional health organizations such as ANTHC. Really, that collaboration is essential for getting out to villages, making those personal connections with people, getting the invitations, getting community buy-in. So it's great to have a community advocate there, a village elder. We love the chances to go into schools and talk to the students, the kids in town. Kids will come and watch what we do. They'll help people bring their pets in, and it's a great time. What's the future looking like? I'm working hard here at UAF with our veterinary students. We are in a 2+2 program with CSU, so we have veterinary students for the first 2 years, and then they go to Colorado State University to finish their 2 years. And we are working to partner and get students out. And so I'm launching the Nanook VetServe initiative, which will be our formalized program to create opportunities to get students out on these trips. We're looking to train community-minded veterinarians through rural outreach. This is a huge student impact. They get hands-on experience. They learn about access to care. What are the challenges? How can we get out there and provide care that's so desperately needed? And we can learn cultural humility. Rural Alaska is very different from urban Alaska, which is very different from where many of our students come from. We have students from all over the United States and other parts of the world. And our long-term goal is to create these sustainable partnerships. And we would love to help see the goal of zero rabies by 2030. These are a couple students. This was here in Fairbanks at a local spay neuter clinic that I do with these couple students participating, and they just love getting involved. And this is one of our former students. This is Dr. Samantha Johnson. She has graduated. She's returned to Fairbanks, and she's one of our partners who goes out on trips with us. And engage in rural Alaska and building the network. And things you can do: advocate for vaccinations wherever you are, support initiatives, whether it's for rural areas or locally. Support those One Health initiatives, recognizing that animal health and human health are very connected, and help create partnerships within local communities. There's tons of things you can do, both financially for volunteer organizations and in kind. You can be a volunteer. You can help pack surgical packs or equipment that's going on trips, or provide food or things like that. So I really thank you guys for letting me share, and I'm looking forward to your questions.
Thank you so much, Dr. Pietsch. That was an amazing perspective on rabies prevention in northern and remote settings. Really great to see some familiar photos as well, of our team members that we've been on the clinics with you in Alaska as well. So next, we're joined by Christina Dragomarecka from UWRF and the 12 Guards team in Ukraine. Christina has been working on the ground to strengthen community-driven initiatives that protect both people and animals. Over to you, Christina.
Hi, nice to meet you to everyone. And also, first, I want to say thank you to all the world. It's from America to Canada, and to all you that you support Ukraine, not only on frontline and also dog frontline, dog animal frontline, animal protection line. It's we are not alone, and it's inspire, and that's why it inspires us to work more and more without rest. I am, as you see, animal rescuer, volunteer, and shelter owner, and also dog trainer. I want to show you my experience, my frontline experience. We advocate with organization 12 guards. We evacuate animals from frontline, and also we meet such disease like rabies. And rabies actually widespread in Ukraine, not just on frontline. It's also in other regions, and it's regions that close to EU border. That's why, and also we wanna be in EU, Ukraine wanna be. So we want to fight this problem because we want to be a safe country that can join to EU. First, I wanna describe our work, and also the problem that we have in Ukraine. Maybe we can connect our power, and we can solve these problems. First slide. First slide. It's the reality, and the reality of situation in Ukraine. Unfortunately, our people, they really don't understand what is it rabies. For them, we are talking with them. We trying to explain that how it's necessary to vaccinate their animals, but especially it's old people, they think that rabies it's behavior of dog, that it's not disease, it's not something that can kill them. They think that it's just weird behavior of dogs. So they said, no, we don't need vaccination because my dog is fine. This is the biggest problem, that we didn't promote what can be. For example, when we are going to the shop and buy cigarette, we see what kind of disease we can have. You're thinking you will smoke cigarette? No, the same should be with rabies. People should know, and they should know reality. We should show them this picture how people die, and in disaster, what can be if they will not prevent it. So this is the one of the biggest problem. People not educated, and we are with 12 guards and all another organization who works with stray animals in Ukraine. We are trying to explain it, and this is how we work, and this is what we should do more. And I think, of course, we should collaborate with government and show people reality. Next slide. Government official. Government. The problem is that government trying to solve this problem, but the people who work in this area, they are irresponsible. They are like going on their job and do everything automatically. But for example, people volunteer. When he's put on their life in the for example, rescuing animals. We are doing it from our heart. The people who do it, who prevention, I mean the government organization who should do it, they do it just for mark. This is the biggest problem. What I think, it should how to fight with rabies in Ukraine. It should be a foreign organization or Ukrainian organization, but with foreigner support that will vaccinate it, and it will be one. For example, the vaccine will have normal condition. For example, we know that it should be in the cold. Some government people who work, they don't do it. They keep it warm, so we know vaccines doesn't work, and this is the big problem. This work should do the people who really dedicated to it, and who really want to prevent a big problem. And next slide. We talking a lot about rabies in in frontline. But to be honest, it's really hard to think about rabies during the evacuation, dog evacuation. Of course, we do everything. We are trying to, if we see that behavior of this animal is weird, we do it in the gloves, or for example, we use with tranquilizer for this animal. But usually when you are there, you are thinking about how to survive and how not to die there, and of course how to rescue this animal. This is our photo from Turretsk. It was one of the most difficult and dangerous evacuation because during it you are during evacuation, you meet a lot of drones that want to kill you, so you are thinking about problem now, how to survive now. But also, you should think about how not to die from rabies, how to not be infected from rabies. So the biggest, I think the solution for such people as we are rescuer, it's to be vaccinated. This is the best prevention, because sometimes we meet some dogs. You know, when you are going, for example, to when you are going to catch stray dogs and it's safe place, you have time to think how to catch this dog, how to prevent everything. But when you're there, you just have 3 minutes, arrive, take dog, doesn't matter what kind of condition, and leave this place because it's super dangerous. And after that, you start to thinking about how safe is it to take this dog. Yeah, this is what I want to say about evacuation on frontline. And also, a lot of organizations, they are talking about and they are work on frontline, but we should work in all Ukraine, because not just frontline have a big amount of rabies. And the such region, for example, like Odessa, it's a region where is my shelter and where I was born. We have also a very high level of rabies, and most of it's going from the forest. We can connect to the next slide. It's going from the forest, and if, for example, even stray dogs, we can vaccinate them, made injection. For foxes in forest, it's impossible to do it. So we are working with our pets or stray dogs, but we are not working with wild animals. I never seen it, but I know that in Soviet Union, government use oral vaccines, and that's how they prevent it. Unfortunately, in Ukraine now, I don't know such experience, but if someone know it and can give your experience how to use it and how it's work, it will be very cool, because even for example in Ukraine, all prides with stray dogs have their volunteer who take care about them, but do every year vaccination for all of the stray, they feed them, yeah, but do them vaccination is impossible because they are wild. But with oral vaccine, it will be good idea, because we can prevent rabies with this vaccine. And I'm sure every volunteer happy to have it, and they will give it to their dogs whom they take care. Yeah, but this is our government, as I know, doesn't use it now, And if foreigners can share with us this experience, we will be very grateful. And our next slide is vaccinate the rear. That was what I was talking about, that we are working on all organizations, working almost all on frontline. But what if we will work not just on frontline? We will vaccinate all Ukraine and have mobility group in different regions. So it will be like this. We will make a border between. We cannot. The problem is that we cannot do vaccination on frontline. We do it, of course, like I told, but it's not. It's not. Maybe it's 20%. It's that amount of animals that we evacuate. To be honest, amount of animals that people live in occupied area, it's very big amount. So it's impossible to evacuate them all. So they stay there and they can spread rabies. And the biggest problem is that frontline is moving. So why we cannot work now in that area that's still safe, and this area where we can vaccinate almost 100% of dogs and cats. And even if frontline will move, this area already will be vaccinated. Even if people will leave their dogs die there. This is the goal. This is the future project that we want to make, and we hope we can collaborate and do it. Thank you.
Thank you so much, Christina, for sharing such powerful insights from all your community-based work in Ukraine, and also for sharing such impactful images as well of all the work you do on the front lines. So finally, I'm pleased to introduce Dr. Katinka Dabalog. Dr. Dabalog is the former Senior Animal Health and Production Officer with the UN Food and Agricultural Organization and brings decades of experience advancing One Health solutions to prevent diseases like rabies. Let's give a warm welcome to Dr. Dabalog.
Thank you very much. Thank you, Dr. Tuma, for the introduction. And well, good evening from Rome in Italy. Yes, I hope you can see the slides. And yeah, thanks again for the introduction, and very interesting also the other presentations that show the realities in two completely different type of countries and conditions. I will try to zoom out a bit and talk a bit about globally, but also then focus into sub-Saharan Africa. So as also mentioned before, there are about 59,000 human deaths estimated each year from rabies, still human death. And if we see where most of these cases are, they're actually in Asia and in Africa. So we always have a big problem to know exactly the numbers because rabies is a completely underreported disease. And often people die and it is never diagnosed, especially never confirmed, because in many cultures, it would be very difficult to have the brain of a deceased person for examination. And then also, especially in Africa, we have a huge lack of laboratories that are capable to diagnose rabies. If we see compared to what Dr. Pietsch was presenting, Africa and Asia are highly rabies endemic countries where people live very closely at risk of contracting rabies. And what we find here that most of the cases are actually transmitted by infected dogs. And also more and more cats, we are finding that cats is also on the rise In Latin America, you have, besides dogs, there is also the bats, and especially the vampire bats, that transmit rabies mostly to livestock. So most human cases, as mentioned, we find in Africa and Asia. So if we zoom in into Africa, and especially sub-Saharan Africa, we see that here also most of the deaths are caused by dog-mediated rabies, and about 40% of the cases are in children under 15 years of age. Why is this? Often, children like to play with these dogs. Many of the dogs are actually free roaming. Also in Africa, most of them have an owner. People let them roam around, and these dogs are known by the community. So therefore, children tend to play with them. But clearly, these dogs can get in touch with like a stray dog passing by, a rabid stray dogs, and then people are not aware and might get in touch with a rabid dog. And often children are also afraid to tell that, they have been bitten and might not always tell the parents. Another problem is that often children are bitten in their face or in the upper body. And clearly, as the virus travels to the brain, there is a much shorter time to receive post-exposure. I already mentioned the huge underreporting of cases in animals and in humans, and there are many social cultural barriers. For example, that people don't want to vaccinate their dogs, especially if they're hunting dogs. They believe there might be not be good hunters anymore, but there are also huge economic constraints. For example, post-exposure prophylaxis is often not available, especially in rural Africa, and the prices are prohibitive. If we think that, people live on $2 a day, paying for vaccination. Fortunately, it's not that expensive as as Dr. Pietsch was mentioning, but still, if you have $2 a day and a post-exposure costs one dose $50, that would be completely inaccessible. We have seen cases where, for example, in a village, 3 children have been bitten, and the family only has money to have one child go to the city to receive post-exposure. I think it's terrible if families need to make these kind of decisions. In 2015, the international organizations got together and developed this global strategy for the elimination of dog-mediated human rabies by 2030. It was a very ambitious plan, but I think together with World Rabies Day that has been celebrated since 2007, it has helped to engage governments, to create awareness at policy level, but especially at community level, because it's extremely important that communities are aware about the disease and what they can do to prevent it. So we often talk that rabies is the model disease for One Health. And here I have kind of illustrated the issues that need to happen in the human health sector and in the animal health sector. So we see that surveillance and laboratory diagnostic is in both, but mostly the animal vaccination has to be conducted by the veterinary services and also the dog population management. While in the human health side, you have the post-exposure and the animal bite reporting and wound treatment. But what we find is that especially, and my slides, animal vaccination is absolutely crucial. As also Christina was mentioning, you need to prevent the disease from spreading by vaccinating the animals against rabies. But what we find the most challenging is actually to have the political support and the funding. Rabies is a completely underfunded disease, and we have been trying to mobilize funds for this, but it's really considered also one of the neglected zoonotic diseases. As mentioned again here, to stress that vaccination of dogs and cats has proven to be the most cost-effective and efficient way to protect human lives. So as we address it in the animal population, we prevent it from spilling over or attacking humans. But recognizing rabies symptoms is very important. And here, as mentioned also by Dr. Pietsch, it is not always the aggressive animal. We also know the silent and the paralytic rabies, where the animals can just change behavior. And especially in wild animals, we find that normally, for example, foxes or wolves would not readily go towards people. They might lose the fear of people, and therefore people might pet them and get bitten or exposed in this way. Also, what we find at community levels in Africa, but even with professionals across the world, that often they are not aware that the most simple intervention is actually wound washing. Washing a wound where they have been exposed to the animal with plenty of soap and water under running water for 15 minutes. This is a very simple intervention, but it can reduce significantly or the virus load. So it's a very simple intervention, especially there in areas where there's no post-exposure. This might be the only intervention possible. So, and as a One Health disease, also, we not only need the collaboration between different sectors, the animal health, human health, the communities, the municipalities, but also across borders, because we know that rabies travels across borders, either by people or often animals might migrate and might move across borders, especially in areas where there is conflict and war. This is where we see that when people move, they move to refugee camps. Often the dogs will follow them. And here is also where we see big outbreaks of rabies. So as the theme of this year's World Rabies Day is very much linked to community engagement, this is absolutely key. It's the community, animal and human health workers at the front lines, the veterinarians, the volunteers, but also the vaccinators and the educators. They have a key role to play to communicate with the communities. And during, for example, when there are these big vaccination campaigns, to mobilize the communities. What we have found during our work in Africa, when we did a dog ecology study many years ago in Zambia, we found that it are the young boys, the ones that are, taking care normally or playing with the dogs. And previously, the governments would organize these vaccination campaigns during the week, and the turn-up was generally low. Since then, we have been encouraging providing information in schools and organizing the big rabies campaigns during school holidays. And you will see it makes a huge difference when these children bring their animals to be vaccinated. So to finalize my presentation, I want to have this call to action. Rabies elimination is not just a technical challenge, but we need the commitment from governments. We need the commitments from communities. So it really needs to cut across. We need to advocate for sustainable funding and vaccine availability. Christina was mentioning the oral vaccination. Oral vaccination has been widely used in wild animals, but more recently, a vaccine has been developed, an oral vaccine that can also be used in dogs. There are still some licensing issues, but most recently in Europe, at least, this dog vaccine has been licensed by the European Medicine Authority. And I think this would also be a very good solution for especially in Ukraine, where many dogs are inaccessible. But still, it would need more kind of political will and funding. I must say here that the oral vaccine is more expensive than the injectable vaccine. We have also to further strengthen the surveillance and reporting system, because without clear information and data, it's very often difficult to advocate for rabies. And important to train and empower the next generation. So I think webinars like these and the work done in schools and at universities in creating awareness are essential to as part of this call for action. We know that 0 by 2030 is ambitious, but we need to make it work, in Africa, but also across the rest of the world. As mentioned in the beginning, rabies is 100% fatal disease, but also 100% preventable. Thank you very much.
Thank you so much, Dr. DeBalog, for connecting local and global perspectives so clearly, and also for highlighting how animal and human health sectors need to work together for rabies elimination. And it's a really great example of One Health in communities. So thank you again to all of our panelists this morning, this afternoon, or this evening, wherever you may be. And now we would love to hear from the audience. Just a reminder, I know that there's been a few questions that have been put into the Q&A chat. If you do have a question, please type it in there, and pending time, we will hopefully get to it. So let's see what is in the Q&A. There was one for Dr. Pietsch from Terry, who might be a Fairbanks UAF student, but also kind of linking together Dr. DeBalog's work in Africa. I'm sure maybe there's some people on this webinar that know that there has been some rabies that has been found in the Cape fur seal population in South Africa. And it's something that, of course, along the Arctic coast where there are seals, that has been a bit of a concern for folks living on the Arctic coast. So the question was, Dr. Pietsch, if you are happy to take this one, how can we protect our indigenous food supply?
Yeah, that's a great question. I'm happy that those seals in South Africa are very far away from our seals. But if that is something that develops in the marine mammal population, that is concerning, because that's a huge food source for a lot of the indigenous communities in Alaska. And, I had the example of the rabid moose, which is a huge food source also. The good news is, well, I don't think anyone would recommend eating a rabid animal or someone you suspected of being a rabid animal. That's not a common way for rabies to be transmitted. And so it might be transmitted like wildlife to dogs when they're eating perhaps a dead fox, if they're eating the neurologic tissue. So if they're eating the brain, that's where the most rabies virus is going to be. That's where there's a lot of rabies virus, and then it's shed in the saliva. So cooking food helps. That's not something that's always done with our seals, if you're down to seal oil. But if there's a animal that appears abnormal and suspicious of rabies, it's something not to eat. And Alaska does have a very robust network for monitoring, including the wildlife. And so the state Alaska Department of Fish and Game can do rapid tests. That moose was tested here in Fairbanks. And so there's mechanisms to send suspicious animals in. So contacting Fish and Game, the village public safety officer, the state of Alaska troopers, University of Alaska, if there are questions.
Amazing. Thanks so much for that answer, Dr. Pietsch. And I guess too that it is interesting to note. I'm assuming in that moose, was it fox-mediated rabies that was found in that moose? And is that the primary strain that's found in Alaska?
Yep, that moose was confirmed to have fox rabies, and that is our primary strain. I believe in Southeast Alaska, there's been a few cases of bat rabies, but fox rabies is what we see.
Yeah, similar to Northern Canada, we have primarily fox-mediated rabies. We're starting to get bats up here, but not yet. So, but of course, I mean, another mammal that can carry rabies far and wide for sure. So yeah, thank you for that answer there. Christina, if we have a question for you as well. So in your experiences in Ukraine, what can or how can communities help support rabies prevention even during these crises that are occurring, like conflicts in the war zones? Oh, I think you're on mute.
Yeah, sorry. You mean foreigner community?
Pardon?
Foreigner community, you mean?
For just, is there anything that on a community level, like, the people of Ukraine who are living their, every day-to-day life, is there anything that that they can do to help support the prevention of rabies spread in the dog population there?
Yeah, I think the best what they can do, we can collaborate in the group and do vaccination. We can have vet, and it can be volunteering work. Actually, the vaccine we can get it free. Just need to take it from government and in the place where they can store it, not from the hands. Take it from the fridge, keep it cold, and then we can collaborate it in different groups and go to the different regions and talk with people about rabies. And as much such groups will be, as faster we will vaccinate as much as we can. Yeah, and really, it will be good to have oral vaccines because that cases that which I had in my life with rabies, it was stray groups with dogs. Yeah, they already were catched. They were sterilized actually by our by 12 guards. But for example, all group was vaccinated and sterilized, but one dog or two was not, and one this dog get rabies. So in this case, we can see how actually our prevention is work, because if another 10 dogs were not sterilized, it probably can be grouped with 10 dogs that had rabies, but now it's just one. But if we had oral vaccine, so this dog was not sterilized because it was really very difficult to catch this dog. But if we, for example, even had oral vaccine, this dog were vaccinated, because a lot of people take care about this group. So I think it's a very good solution to find a way how to get a lot of oral vaccine.
Amazing. Thank you for that. And I know that Dr. Devalag also kind of touched on oral vaccines as well, and they have been used in many settings around the world, and potentially, yeah, in the setting in Ukraine as well. So that's just coming up is, do surveillance in low resource or remote settings, do any of you have thoughts or examples of how health workers contribute to collection and transport for rabies diagnosis? In many places around the world where there isn't much access to veterinarians, and having to have veterinarians present for rabies vaccinations, I'm just wondering if you have any thoughts on the use of community animal health workers to help improve rabies diagnosis. And anybody can take this one.
Yes, if I may, community animal health workers have a huge role to play. I think it has been recognized that often, they are the ones that are in living in the communities, they are in the field, and when they receive a specific training, they can be incredibly useful. One has always to be careful, because rabies is such a dangerous disease, to ensure that they are not put at risk when they're taking samples. I saw in the chat that there was the question on the sample taking. There are methods that are more safe. For example, the straw method, where you do not need to open completely the head of the animal. You can just insert the straw from the back of the head. So there are methodologies that can be helpful to get samples, or getting near the eye. So, and also more and more there are being developed these field tests, like these lateral flow tests, that can also be very helpful to diagnose rabies in the field. There was this other question linked to this, is the underreporting. We know that rabies is very much underreported, and the estimates of 59,000, it's an estimate that was based on a study that was a very extensive study that was done looking at different countries around the world. So clearly we need much more harder data, but it's always, we cannot wait till we have all the data. We have to do something now. We cannot let time pass. And the more we, if I may just, I see also the other question on the wildlife vaccination. Yes, Europe has been able to completely eliminate fox-mediated rabies through oral vaccination. But there is a small difference between dogs and foxes. Foxes are solitary, so you can drop these baits, and in large areas, there are calculations where you can drop the baits and vaccinate these foxes. But with dogs, they are in packs often, and when you have provide vaccine, just like that, distributing it on the ground, the alpha male will eat everything. So you need to have specific techniques how you ensure that all the different dogs actually are able to ingest the oral vaccine. Back to you, Michelle. Thank you.
Amazing. Thank you for that. Dr. Pietsch, anything that you wanted to add?
I was thinking about oral vaccines, and that's been effective in many areas of the world, including the United States. We're not doing that here in Alaska, and I would imagine probably not in northern Canada. And it's a huge logistical issue for us. Most of Alaska, most of rural Canada doesn't have any sort of road access, and we have huge areas. Alaska is over 2.5 times the size of Ukraine, so a huge area, and we are seeing it in our foxes. And the Arctic foxes are our classic species. They're not just terrestrial; they spend a huge amount of time out on the sea ice. So it's not just the map of Alaska, and they've been reported, I think hundreds of miles out on the ice, and they'll follow the polar bears and scavenge seals left over from the polar bears, and may migrate to Russia or Canada. So there's a lot of movement. So that's hard for us to do, to get in there and do that and eliminate it from our wildlife population. Another struggle that we're seeing here in Alaska, and I would imagine is perhaps a concern elsewhere in the world, is with climate change. We're seeing things change, and that's happening rapidly in the Arctic. So our classic species of concern has been Arctic foxes, and we're seeing it more and more in the red foxes here, which red foxes range all over Alaska. So that's what the type of fox I have here in Fairbanks. And we're also starting to see it come more frequently in cycles. There'll be outbreaks historically every 3 to 5 years in Alaska, and they're starting to see spikes every couple of years now. And so while we've been doing well, there hasn't been a human death in Alaska since, I believe, 1948. there may be more risks developing.
Definitely, and you're right, Dr. Pietsch, that it's very similar to Northern Canada as well, where the fox population and fox-mediated rabies is difficult to manage with oral vaccination just because of the vast range that they cover across the whole circumpolar region. So thanks again to everybody who attended and to all of our panelists. Just quickly, as we wrap up today's session, I know we're at time, I just wanted to highlight a few key takeaways. As we've all heard today, many times, rabies is 100% preventable, but it requires awareness, vaccination, and collaboration. One Health approaches, so connecting human, animal, and environmental health, are essential to achieving progress in rabies elimination. And everyone has a role to play, individuals, communities, and global partnerships. So hopefully, also it was highlighted that there's some funding that needs to be increased, more awareness around it so we can all do our part in increasing the awareness of rabies and how it is 100% fatal, but 100% preventable as well. So if you'd like to learn more or to get involved, you can visit our website at vwb.org and upcoming initiatives. And on behalf of VWB, I want to thank again our wonderful panelists, so Dr. Pietsch, Christina, and Dr. DeBalog for sharing their expertise. And again, thank you to all the participants for joining us today. Together, hopefully, we can put all of our efforts together to reach the goal of zero human rabies deaths by 2030. So please take care, and thank you again for being part of World Rabies Day 2021. Have a great day, everybody, or great evening.
Thank you.